Hello friends, today we will discuss one important remedy from our Mater Medica. In fact, this is the remedy which is very useful in septic states where hemolysis is associated with septicemia, where platelet disintegration is there, where hematemesis is there, where hemorrhagic tendency is there, and person goes into the septicemic state. I have used it many times where the general allopathic medicine never works, or it causes a lot of depletion, platelet depletion, bone marrow depression, and patient is not getting recovered from the fever. This remedy does the wonder. And this is nothing but a snake remedy, Crotalus Horridus. This remedy generally gets overlooked. We never look towards the Crotalus Horridus. Generally we think of lachesis very commonly when we think about the snake remedy. When we think about the septicemia, the first thing comes to our mind is the pyrogen. But there are differences between all those remedies, and that is what we have to learn in today's session. If we'll go through the Allen's notes, we'll understand the clinical perspective of this remedy, how to utilize this remedy, and we'll compare the remedies at the same time. So let us start with the keynotes. Open your keynotes. Crotalus Horridus. It is a poison of rattlesnake, Crotaliidae. It is indicated in strumous, debilitated, hemorrhagic, broken down constitutions, during zymotic diseases, in inebriates, tendency to carbuncles or blood boils. See what he says, strumous constitution. Strumous means when glands gets affected, generally the thyroid gland which gets affected. This is strumous constitution. Debilitated, hemorrhagic, very important. The person gets debilitated, and that debility is very marked in Crotalus Horridus. The person gets fever, he gets affected, he goes into the septicemic state, and he gets totally debilitated. And where bleeding tendency, you can find it out. There might be a nosebleed, there might be hematuria, there might be hemoptysis, there might be hematemesis, anything. But that hemorrhage is because of the septicemia. It is because not because of the congestion, but it is because of the platelet disintegration. So this hemolysis is very important. The platelet disintegration causing the hemorrhagic broken down constitution during zymotic diseases. The zymotic diseases are nothing but the diseases where you get such types of fevers, the dengue fever, then the COVID, then the swine flu. These are diseases which are of a recent origin, and where the persons who gets affected are the inebriates. This word is very important. Those who are alcoholics, alcohol drinkers, those who are smokers, these are the persons who gets more affected. And in such persons, if this hematemesis happens, if this septicemia develops, and patient lands into shock, patient can land into the death very fast. This is what happened in last COVID episode. Many people who were drunkards, who were smokers, gets affected and they died during that fever. This was the very important remedy if you would have used in such types of cases where COVID is positive and patient is affected, and at the same time there is platelet disintegration, then patient is suffered from the thrombosis, the patient suffers from the all of a sudden embolism, thromboembolism, and patient got the myocardial infarction, patient died. This is common picture in between the second wave of the COVID. This was the important remedy if patient is in ICU in septicemic state, and this remedy had done the wonder. So inebriates, those who are alcoholics, drunkards, tendency to carbuncles and blood boils. Carbuncle is a very important thing. Carbuncle is big hard indurated boil, and generally carbuncles happens to be there in diabetes. But these carbuncles, mortality is always high. It is one of the indication which indicates that this patient is going or landing into the septicemic state. It may land into, and that's why this is one remedy one should not forget. there is comparison, anthracinum is given. But anthracinum, there is a tendency to boils, but those boils are typical streptococcal origin. Those boils are generally external manifestations of the streptococcal infections. Here it is septicemic state causing more and more damage. It is more deeper plane it affects in Crotalus horridus. Disease is caused by previous low state of the system. That means patient is already having low susceptibility, who gets affected because of deeper problems. Low septic typhoid or malarial fever. See, this is very important. Low septic typhoid and malarial fever. Patient is suffering from malaria, patient is suffering from typhoid, patient is suffering from dengue, and in such cases where you never get high grade fever, but patient is landing into the septic states, where patient you never immediately catch it out that patient is landing into septicemia, but this patient goes into that. Chronic alcoholism, this is the basic reason. So this is not with the generally healthy persons who gets affected with the typhoid, malaria or dengue, but those chronic alcoholics. Exhausted vital force and genuine collapse. Exhausted vital force means they are absolutely debilitated. They don't have the strength to sit down. They are always lying down over there in the bed. And last word which he has used, it is called a genuine collapse. They try to sit and they suddenly falls down. This is genuine collapse because of the low septic states as well as the circulatory failure. Apoplexy. What is an apoplexy? It is pre-paralytic or paralytic condition due to the congestion to the brain. But what he says, apoplexy, apoplectic convulsions in inebriates. Again, the convulsions which are appearing in the drunkards, alcoholics, because of the congestion to the brain. This is one remedy one should not forget. Hemorrhagic apoplexy. It is not infarction producing paralysis, it is hemorrhage which is producing paralysis in case of Crotalus horridus. Or apoplexy in broken down constitution. So who are already degenerated, who are broken down, who doesn't have a strength, and in such patients there is apoplexy. This remedy does the wonder. Hemorrhagic diathesis. This is already we have discussed. Blood flows from eyes, ears, nose, every orifice of the body, bloody sweat. So hemorrhage is very typical, and this hemorrhage is generally because of the platelet disintegration. Low platelets, this is first remedy to be think of, generally in septicemic state. Yellow color of conjunctiva. This yellowness is because of the hemolysis, bilirubin and biliverdin, which comes out and ultimately producing a jaundice. So this jaundice is not of a liver pathology, this jaundice is because of blood destruction. Clears of vision after keratitis or keratoiritis. So this remedy indicates that this is good remedy for keratitis, this is good remedy for keratoiritis. Keratitis is nothing but the corneal ulcer. So syphilitic trait is there with this Crotalus horridus. So this is the remedy which goes into the psychosyphilitic state, and this is very important remedy in such types of cases. Malignant jaundice, hematic rather than hepatic. See, this is very important word which has been used by Allen. This is hematic jaundice. Hematic means the blood is at fault, not a hepatic. Liver is not at fault. So this is malignant, it is ever increasing because hemolysis is continuous, and because of which bilirubin and biliverdin are increasing. Purpura hemorrhagica. So you get many petechial hemorrhages. Comes on suddenly from all orifices, skin, nails and gums. Everywhere you can find it out, this hemorrhagic tendency. Tongue is fiery red, smooth and polished like pyrogen. In both remedies it is same. Pyrogen is also remedy for septic state. Crotalus horridus is also a remedy for septic state. Here in pyrogen, the tongue is intensely swollen. So swelling is marked. Both remedies are having the varnished like tongue, but pyrogen you get a maximum tachycardia which is not proportional to the temperature. Crotalus horridus, it is proportional to the temperature. So that is the difference between the pyrogen and the Crotalus horridus. Malignant diphtheria or scarlatina. See, this is again everywhere you get this malignant work. Malignant means it is more increased, more spreaded. So diphtheria, which is more marked, or a scarlatina. Scarlatina means a rash which is associated with the fever, which is also marked. Edema or gangrene of the fauces and tonsil. So if you ask the patient to open the mouth and see his throat, you will get the congested throat over there. The fauces means you get the vision, that is a fauces, pharyngeal appearance. Or tonsils, they get gangrenous edematous. Pains aggravated by empty swallowing. So if patient just swallows his saliva, it gets aggravated. If vomiting or diarrhea come on. So malignant diphtheria, scarlatina associated with a pain, and it is associated with vomiting or diarrhea come on. Prostration of vital force. So vital force is absolutely deceased, lowered. Pulse is scarcely felt. Blood poisoning. See, pulse is scarcely felt. For patient is landing into the circulatory failure. So circulatory failure, shock state, septic state associated with a loss of strength, prostration. This is one remedy along with the pyrogen you can think of. Vomiting in Crotalus Horridus. Vomiting is bilious with anxiety and weak pulse every month after menstruation. So every time after the menstruation, vomiting you get with the patient. Cannot lie on right side or back without instantly producing dark green vomiting, black or coffee ground of a yellow fever. See, this is very important. Generally this is having a dark green vomiting, but more important is coffee ground or black vomiting. Coffee ground vomiting or black vomiting is generally because it is a gastric hemorrhage, and which remains for certain time, and when it comes out it always becomes coffee ground. This is again happens in cancer of the stomach, the commonest thing. This remedy is a very important remedy for gastric ulcers as well as gastric cancers. So Crotalus Horridus is a remedy for the syphilitic miasm, cancer miasm or psychosyphilitic miasm. Diarrhea, the stools are black, thin, like coffee ground. So see, this is what is indicating that hemorrhage is occurring in the intestine also. The diarrhea is offensive from noxious effluvia or septic matters in the food or drink. Diarrhea from high game, like pyrogen. This is a good word. High game, people understands it in a different manner. But high game, what exactly it means? It means meat from those animals that is left to the edge and decomposes for a bit. So decomposed meat causing a diarrhea, this is very important remedy, like a pyrogen. High game means decomposed meat. Diarrhea during yellow fever. What is an yellow fever? This word again comes. Whenever the fever is associated with hemolysis and producing the jaundice, it is a yellow fever. Cholera, diarrhea happening like in cholera, typhoid and typhus. Typhoid and typhus, these are two different terminologies. Typhoid is a disease specifically caused because of Salmonella typhi. Typhus includes many varieties of infections, GI infections, where the fever is associated. It is not specifically related with the Salmonella typhi. It is a big terminology comes under the word typhus. Intestinal hemorrhage, when occurring in typical septic and zymotic disease, blood is dark, fluid and non-coagulable, and this is what is the septic hemorrhage. Septic hemorrhage occurring in intestine, this is common. So nowadays this happens many times with the patients who are suffering from the dengue or viral fevers, and these states are quite common. Crotalus Horridus, one should not forget. I know that one patient who was admitted in KEM in Pune. I know him from 20 years, but he has shifted from Sangamner to Pune, and one day he was having a fever, then admitted in the KEM, and he was diagnosed with dengue. His platelet disintegration was very marked. His platelets were nearly about 11,000, and all of a sudden he started getting hematuria. So there was a call for me what to do, because doctor has told that we have to give the platelets, and it is very risky now to settle with that patient. I have suggested that you bring this remedy, Crotalus Horridus, give it 3 doses, and that continue with the Nux vomica along with that. Nux vomica for further repetition in order to remove the bad effects of the allopathic medicines which were consumed for 4-5 days. Next day, immediately after giving 3 doses, there was the hematuria stopped, and next day the platelets started increasing thereafter, and within 3 days he was again normal. So this is very important remedy in such types of cases. Dissecting wounds means wounds which are crushed injuries where there is a lot of infection, insect stings, bad effects of vaccination. So this is very important remedy for bad effects of vaccination. We know the thuja, we know the silicea, we know the antium tartaricum. This is one more should be there in our armamentarium. Vicarious menstruation. What is vicarious menstruation? Vicarious menstruation means instead of a normal outlet, it comes out from anywhere. It is a vicarious. Vicarious in Marathi we can say च्याऐवजी. It is in place of. Vicarious menstruation in debilitated constitution. Wherever the constitution is debilitated, weak, like digitalis, phosphorus, this is one more remedy. But in Crotalus Horridus, it is septic state. In phosphorus, it is hemorrhagic tendency. In digitalis, it is because of circulatory failure. Menopause, intense flushing and drenching perspiration. We think of lachesis generally, but this is one more remedy one should not forget, where the climacteric syndrome is very marked. Faintness and sinking at the stomach. So there is a faintness, then sinking at the stomach, there is prolonged metrorrhagia. Prolonged metrorrhagia means there is a continuous intermittent bleeding goes on, where quality of blood is dark fluid, offensive, profound anemia. So metrorrhagia producing anemia over there. So this anemia is hemolytic anemia. This anemia is because of prolonged bleeding. This anemia is because of the hemorrhage. Malignant diseases of the uterus, great tendency to hemorrhage, blood is dark fluid and offensive. So this is again one important thing, where malignant diseases of the uterus you can get over there any variety where bleeding is very marked, and that bleeding is having typical color, that is it is dark colored, it is offensive and it is fluid. Offensiveness generally is the state which develops whenever the septic states arises, and that's why the discharges in Crotalus Horridus is always the offensive. Relations, compare elapse, lachesis, nausea and pyrogen. 3 out of them are out of these 4, 3 are snake remedies: elapse score, lachesis, nausea. Every remedy has its own presentation. Pyrogen, yes, pyrogen for the septicemic state already we have discussed, compared. Lachesis is quite hard. Lachesis is a remedy which is quite hot. In lachesis it is left sided, in Crotalus Horridus it is right sided. Then nausea comparatively is a very dull, slow, sluggish personality. Crotalus Horridus, lachesis, those are not like that. They are very active, quick to act. So there is a difference between nausea and the Crotalus Horridus and elapse. In lachesis, the skin is cold, clammy. Crotalus Horridus, it is cold and dry. See, this is the very specific difference which is mentioned by Allen. So skin is very cold and clammy, sweaty in case of lachesis, whereas here you get the dry skin more associated with the coldness. Elapse is also compared. Elapse, affections of right lung with expectoration of black blood, which is very marked with the elapse score. So this remedy one should not forget. In few words one should keep their mind that hemolytic septic states leading to thrombosis, sometimes thromboembolism, sometimes platelet disintegration, sometimes hemorrhage, this remedy is a very important remedy. So this is, one should learn this by heart. So that's all for today. And today is Ganesh Chaturthi. So Ganpati Bappa Moria. Thank you.